All right, and we should be live. Hello, everyone, and welcome back to another session with Dental Shadowers. We have a unique and exciting presentation today with Dr. Lan, U.S. Air Force dentist. Dr. Lan, thank you so much for taking the time out of your weekend to meet with us. And please feel free to take it away whenever you're ready.
Awesome. Well, thank you guys for having me. First of all, you guys seem really, really organized. And it's great that you guys are providing this opportunity for, all the pre-dentals and even people in dental school. I feel like you get benefit out of these kind of talks. Watching a couple of the other presenters that you had on, it's really impressed by like how you guys are doing things and like the stuff you're providing. So it's an honor to be on here with you guys.
We appreciate it.
Awesome. So a little bit about me. I was born in the north of Minnesota, and soon after, I think it was like 1 or 2, moved down to South Florida in Miami, grew up there. Then fast forward lots of years, found myself at the University of Florida, Gainesville, Florida, where I studied nutrition, major, and then I minored in business administration. Because at that time I kind of knew I wanted to go into the dentistry route. So I figured, why not to get some basics in business. And then nutrition, I just, I looked at the classes. I was sitting there deciding like, I first started out with biotechnology, and I just because it sounded cool. And then my dad just asked me one day, with my freshman year, like, all right, like what? Yeah, that sounds awesome. Like, what is that? And then sat there and I looked at him. I was like, I couldn't even tell him what biotechnology was. So then at that moment I knew like, all right, I probably, this is something I'm not even passionate about. So I went ahead and switched majors to nutrition because fitness and nutrition is something I'm way more passionate about than biotechnology. So that's why I studied in undergrad, and then had the opportunity to go again, stay in the same school for dental school. I'm a double Gator, go Gators. And currently I am with the U.S. Air Force in AGD1, or an Advanced Education in General Dentistry residency program. And it's a 1-year program. Things I like to do for fun, music is huge for me. It's how I relax and kind of like wind down during the day, give myself a little study break, use the other side of the brain a little bit. And then also, tailgates with my friends. We're watching sports, nowadays it's a little different, but yeah, that's what got me through undergrad and dental school. All right, so my journey to becoming a general dentist kind of went back and forth between a couple of jobs, like just growing up, like just thinking what I wanted to do. I actually originally wanted to be an architect because my uncle is and he was an architect. He owned his own place in Taiwan. Is very successful, and I just loved, like, it was so cool, like watching him design stuff on his computer, like 3D like models and stuff, and then going with him to go to the site and like see this thing like being built and designed. So really like the art aspect of that. And then another year during the Thanksgiving party that I went to with my family, one of their family friends, she was a pharmacist. I kind of worked out in the community, started talking to me about like medicine, interacting with her patients and stuff, and that got me really interested. I was like, wow, medicine seems great. Interacting with these people, like you're really being able to help change their lives or make an impact on them. They come to you with an issue, and you can kind of do something about that. So that started getting me interested in the healthcare field. And then just randomly one day, just like a lot of you probably, had my braces off, felt great. And I just decided to ask my orthodontist if I can come, just shadow him for a couple of days. In a couple of days, turned in a couple of weeks, turned into, I would go there whenever I had free time. And I loved it. I mean, he would see, kids all day, and then even some adults, like, he'd treat families and stuff. So I really like that, the patient care, continuity aspect of it. And so after a while, he was like, man, Sean, well, if you want to get to this dentistry thing, like I'm an orthodontist, it's a specialty. You have to make sure you like dentistry first. So he referred me to go see his good friend in town, Dr. Shree. Dr. Shree owns a private group practice, him and his buddy, Dr. Tom. And while chatting with them, that's when I really knew that dentistry was right for me. And obviously, when you guys are shadowing, it's great to, to focus on the patient care aspect of it. And by patient care, I mean, the treatment portion, right? Like, oh, how to do a filling or what the process is of doing a root canal. But, all those things it's great and all because you want to see, if this is right for you, if that's the kind of work you want to do. But more importantly, once you get that, you're like, you check that box, you're like, okay, yeah, this is something I could see myself wanting to do this, this kind of work. You want to start thinking about the other aspects of dentistry. And this is something that Dr. Shri and Dr. Tom kind of talked to me about early on, like very early on in my pre-dental career. And so when they're there, they'll show me all the procedures and stuff, but then during lunch, they'll sit down and be like, all right, hey, like, it's great, you just saw these procedures, but like when, and you're asking all these great questions about like why I did this or why I did that. But they said, start thinking about questions that don't have to do with dentistry. So they really prodded me to ask some questions about how they run their practice, how they treat their team members, like what issues they face in that aspect. Then also like issues with patients, right? You're dealing with people. People is probably the hardest thing that we have to deal with as dentists, right? You have to make them feel comfortable in a very uncomfortable setting. Not a lot of people like to go to the dentist. So that was the more important part that I got out of my shadowing experience. I got exposure to multiple settings. So obviously I got to go to private practice, several specialties. I went into oral surgery, private practice to see what that was like. And luckily I was able to go to a big, dental school for undergrad at UF. So I had access to go shadow in the dental clinics and see how exactly dental student life was. And then also to see all the specialty residency programs that they had there. And then a really big volunteering experience that I had that I really liked was serving in the underserved community clinic. And that kind of spurred me on, in my later on my dental school career to go for mission trips and continuing to serve in those volunteer settings. Yeah, I guess do I take questions like as we go along, or should we just save them to the end?
Yeah, please feel free to continue with the presentation. We'll take questions once you've concluded.
Okay. Let's see. Oh, volunteering. I guess I could touch on volunteering a little bit. You hear this word a lot, and obviously it's, you should go volunteer, but more than just having like, oh, I did like 500 hours, put it on your ads application. It's kind of what you get out of it. So go volunteer. If you go to church and your church goes to a soup kitchen, like do that. It doesn't have to be dental related at all. It really has to do something that you actually care about, and then that you can actually, when you're in an interview, they can ask you and be like, oh, what did you do for your volunteering? They could really tell the difference between something, oh, like, yeah, I went to this free clinic and helped do exams or pass instruments for a dentist. Or you can talk about, oh, like my church, local community, we did this event this year, and then the next year we did like a food drive, that kind of stuff, that kind of story. They can really up your interview and up your application.
So don't spread yourself thin and really focus on something you're passionate about.
Exactly. Yeah. Don't just do things, just for the check mark. Yeah, it looks good if you have a lot of hours, but what's going to set you apart is, literally how you talk about it. And people can tell when you're just kind of rattling off things versus like, oh, like this was like, my trip to the Dominican Republic, like this is like, it was so great. Like I had to go back next year. Like they can really tell the difference.
Right.
And that's not that, it's you need to have all your experiences like that, but those are the kind of experiences that they want to hear about, that you talk about in your interviews. So what is general dentistry to me? This is actually a pretty good question when I saw this slide when I was preparing for the presentation. But it really got me thinking, and it kind of narrowed it down to a couple things. So to me, general dentistry is a lifelong practice, just like any other healthcare profession or profession. The first thing is clinical skills, so patient care. So you have to be a good clinician, be good with your hands, make sure you're proficient in the care that you're providing, your technical skills. Another important aspect is the interpersonal skills. So caring for your patients, right? So there's a difference between patient care and caring for your patients. So caring for your patients, to me, if I do good dentistry, that's only half of my job, right? If patients are coming to you, they're coming to you because they're in pain or they want something done to improve their smile or aesthetics or some aspects of life. But, you know, a lot of people have anxiety about coming to the dentist or going to the doctor. So a big part of your job or, you know, as a dentist or future dentist is to make them feel comfortable, really connect with them, and, you know, make them feel like, okay, their best interest is also your best interest, right? So that's another. I always tell myself, or I always tell my patients, if you're not comfortable in my chair, you know, I don't make you feel like you're, you know, help you with your anxiety, then I didn't do my job right at the end of the day. And lastly is leadership, right? You're going to be the leader in your clinic, wherever you work at, whatever setting you work at. You know, you're the doc, you're the dentist. So people will look up to you, and people will look at every single little thing you do, you know. And that goes down to how you treat your staff, how you treat your patients behind the scenes, you know, and really how you act too. Like if you're in between patients, like scrolling on your phone, if you have like 5 minutes, then people are going to see that, be like, oh, like it's fine for me to do that if I have a little bit of time off too. So instead, you know, like you really have to be the role model for your team. And then lastly, general dentistry puts us in a position where we obviously have a good lifestyle. You know, we're thankfully don't have to be worked to death like a lot of our physician brothers and sisters. We have more extra time to go along with their job. So that's an opportunity, a great opportunity to give back. We'll have more time to do volunteering, mission trips, and community involvement. So I feel like that's a huge blessing to us as general dentists. Some advice for college. I've been getting a lot of questions as well, just through my Instagram about grades and DAT. You know, everyone that's applying, you know, it's big questions. Oh, is my GPA good? Is my DAT good? And I feel like a lot of the focus is unfortunately shift on those two numbers because, and they are important numbers, right? There has to be a way for schools to kind of sift through the thousands of applications they get. But at the end of the day, it's, you know, it's just a number and one portion of your application. So what do I mean by grades and DAT is not just a number? Well, grades and DAT, someone can have a 4.0 GPA, but then have no idea how to manage their time, or, you know, maybe who knows what they had to do, you know, or maybe all they had to do was school, right? And didn't have to worry about anything else. So what dental schools can see is, you know, someone that's, you know, if you just took physics over the summer and that was the only class you had to worry about. And of course, like if you get an A, it's going to be not easy. You know, physics is not an easy class, but you're going to have less things going on versus I had a friend who had to work all through undergrad, and you know, she had to have a part-time job, and she had to take all the same classes I was taking. And that's a huge difference, right? Like, I don't know how she did that versus me. You know, I had objectively more time, you know, more downtime than she did, but we still ended up, you know, in the same place. And so all that kind of stuff kind of comes together. You know, someone might have a lower GPA because they had to, you know, they had family issues, or they had to work, or they had other things going on that might have, you know, not allowed them to fully give their time to their grades or their DAT. So again, like that's, you know, if you have a little bit lower grades or DAT, like don't freak out about it. You know, just really just try to improve yourself as you go along, and just realize that, you know, they look at you kind of holistically. Okay. And then another word I hear a lot is like, oh, like what kind of like leadership should I do? And I feel like in the beginning, especially for me, during the, you know, my pre-dental days, like I was like, oh yeah, I just need to be the president of something, or like the treasurer here, you know. But it's not so much like looking back and now, no, like being in those positions or having been in those positions and held those positions, just like many of you will or have. what that really means is like going through not going through the motions, but getting that experience of being a leader, right? And so that means maintaining your vision. Like as a leader, you know, we all want to do things, right? Stick our hands in the pot and help solve this problem or that problem. Say you're working on a project, or you're planning an event, right? As a leader, your job really isn't to make sure the caterer's got the food all squared away, or the person's got the decorating person's got this and this picked out, right? So your job and our natural tendencies is to stick our fingers in and be like, oh, let me help out with that, or let me help with this, because you want to feel like you're being useful, right? But as a leader, your job is actually to maintain the vision of overall the mission, which is planning this party or planning this event that you're putting on. And what that comes with is delegating jobs to your team. And although that might not seem like you're doing a lot, like, oh, wait, yeah, John, go do this or go do that. A good leader can realize like, oh, this person has these qualities, and this is why I should put them to go do or organize this part of the mission or that part of the mission. Okay.
And there are practical applications to those, prerequisite experiences to dentistry.
Oh yeah, for sure. And then another big part of being a leader is holding others accountable, right? So if, I thought, oh, John would be great at, doing the decorations because he's got a great eye for things and he's got attention to detail. Like, let me put him on setting up the decorations for the event. You got to hold them accountable, right? You've given him objectives that you wanted him to do. And so you have to hold him accountable. All right, by this week, I want this done. So throughout at that week, you got to make sure you call up John, like, hey, John, how's it going? Just update me what's going on. And then, if, John being the awesome person he is, be like, yep, I got you. Don't even sweat it, brother. Like, I got this, and this done. Okay. And lastly, your job as a leader is to also keep the team motivated, right? Like, oh, good job. Everyone's doing great. And keep the momentum going. So I think the biggest thing that I learned, pre-dental up until now, is that leadership is not just doing, the biggest thing I learned is like to learn not to stick your fingers in the pot, right, all the time. You don't have to be doing the technical aspects of the job to be useful. In fact, as a leader, there's a joke like, if you're a good leader, you're not really doing much.
That's
right?
Awesome.
Right. So, but what you are doing is making sure that you're directing everyone in the right direction. So you're the one that has to sit up here and kind of look down at the playing field and making sure that the whole game is being played right. Okay, so that's how I feel about that. Okay. Well, are there any questions about that, or should we hold them to the?
Yeah, our chat moderator is logging questions for the end of the presentation. So,
okay.
Feel free to continue.
Keep rolling. Okay, so right now I'm in residency. I'm in residency, so it's a little different from private practice or practicing in like a real, the same pace as a normal clinic. So a lot of residency, for those that don't know, there's 1-year residencies that you can do, or even 2-year residencies that you can do in general dentistry that really expand upon the fundamentals that you learn in dental school, right? So the goal of dental school is to kind of teach you the basics of dentistry, simple operative, fillings, single crowns, dentures, and simple extractions, right? The very bread and butter, the base of the pyramid. And there's nothing wrong with that, right? There's the cool thing about dentistry is that there's so much in dentistry to do. You just kind of find your own niche and, see what you like to do. And if you want to do more, you go to a residency program or a specialty program in order to do those things. Or if you like doing it all, you stay a general dentist. And even as a general dentist, you have everything to pick from. So the main point of going to, or why, in my opinion, why I would choose a general practice residency is if you're sitting there, you're like, oh yeah, like feeling like basics of dentistry is great, but I kind of want to do, bone grafting, or I kind of want to place implants. or be able to do a little bit more endo than just premolars and single rooted interiors. These are the kind of skills that you can learn in a residency. So my typical day, the military, we wake up really early. I'm not a morning person at all, but since I've gone to the military, I've kind of really adjusted to that. So I wake up at 4:45 in the morning, get my glass of water in, get my breakfast smoothie in, and then I try to get to clinic by 5. And from 5 to 7, I'm doing like prep work, right? Patient management, just making sure all my patients getting scheduled, the lab work is getting done that they need to get done. And since I am in a residency program, there's homework, right? So lit review, case presentations. If attending asks you a question from a previous patient, you better know the answer the next time they ask you. So just doing research, personal research, and doing my homework from that time. Then from 7 to 11, we have patient care time. So depending on what day it is, we have morning and afternoon blocks. And so, for example, in the morning, I'll have an operative block where I'm seeing 1 to 2 operative patients. And then in the afternoon, I'll be doing, endo with the endodontist. So it just depends on the day, but typically, I mean, it's a general practice residency, so we see all the specialties, right? We see perio surgeries, pros, oral surgery. Once a month, we have orthodontics. We're lucky enough to have a pediatric dentist at our base, so we get to learn about a little bit more about pediatrics, oral sedation, that kind of stuff. And then treatment planning rotation as well. And treatment plan is actually something that's really important that I'll get into a little bit more later. But then after that, at the morning care session, we have about an hour and a half for lunch. And I say lunch because usually me and my resident mates are just, doing the same thing as I do in the morning, right? Getting your lab work in, doing your notes for your morning patient, and then kind of admin work. So you're kind of eating as you go, shoving it down, and then getting your work done. And then in the afternoon, until about 4, we have patient care again. After that, we just have lots of notes, lab work, same thing over and over, lit, read, learn, work on presentations, have a little bit of, me time sometimes, if I'm lucky. And then I try to get to bed by 10 to do it all over again. So busy days. What kind of complaints do patients present with? So in the military, we see bit of a different patient population than a normal private practice, in that the most of our patients are active duty. So they're young, healthy, 20-something people, 20-something male or females. And usually most of their care is simple operative, third molar extractions. Some of them that have, gotten other extractions, we need implants, and then also root canals. That's kind of the bulk of what we see. In residency, because I'm in the residency, we also get to see the retired and dependents of the active duty members. So this population is usually the older population, and by that time, if you're getting older, there's higher incidence of periodontal disease. So we get to do perio surgeries, again, implants, root canals, and whatever else they need. And lastly, we get to see patients through sick call or tooth call. Where we get to see, people come in overnight. Oh, my tooth really hurts. Might need a root canal. Someone might have hit their head, tripped over their shoelace or something, hit their face on the curb, broke a couple teeth. We've seen a couple of dental trauma cases, and also a couple of dental abscesses. People come in with, a tooth that's just not happy, and there's a big infection that we need to drain. And so the biggest thing for sick call, when you guys get into dental school, is kind of determining if something is urgent versus emergent, right? Luckily, as general dentists, we don't have to, be on call per se, like our physician brothers and sisters. We kind of, the procedures we do are more elective, but there are dental emergencies, right? So you have to kind of determine if something's emergent versus urgent. So obviously, if someone's coming with some tooth pain, they call you up at 10 p.m. You can kind of be like, okay, are you having any swelling? No. Difficulty breathing? No. Okay, I think you're good enough to come in tomorrow, where I'll have my whole team here and we can, see what's going on. Versus someone that calls you, they're like, hey doc, like, I just got this huge abscess going on down below my mandible, and it's kind of feeling weird to swallow, like it's kind of hard to swallow. That is your red flag. That is, that is an emergency. You want to, go in immediately and kind of see the patient and see what you can do for them, and make a referral if you need to. Okay, so what kind of procedures do I typically perform? So I just kind of broke it down by specialty or different aspects of dentistry. So for operative, we do a lot of what's called periodontics or compromised treatment plans. Or not a lot, but we get to do these kind of cases where that take something that you would typically not want to try to save in private practice just because of time and money. But in the Air Force, we have all the care is free for our patients, so we get to kind of throw the kitchen sink at a tooth and do like endo, post and core, and all this other crazy stuff in for one tooth that would cost the patient normally like thousands of dollars.
So would you say the scope of treatment is more extensive than an ordinary AEGD program would offer?
I wouldn't say so. I would say it is Air Force residencies and military residencies in general are considered like pretty good programs. So I would say, if you compare it to a good civilian AEG program or GPR program, we're pretty comparable. But the added bonus is that all the care is free for our patients. So
right.
We get to do some of these things that other residencies may not get to do. But again, like different residencies, like for the one thing about the Air Force residency that you don't really get as much experience as is implants, right? The goal of so in the Air Force, we have A dentists and we have C dentists. So A dentists are comprehensive dentists, and they have to go through a 2-year AEG program. And it's a lot more extensive. You get to do posterior single implants in that one, but their goal for the C dentist program, which is what I'm in, which is the 1-year AEG program, is just to make sure that all the dentists coming into the Air Force, everyone has different experiences in dental school, so they just want to make sure that everyone is on the same playing field once they graduate the residency program. So that's the main purpose. So that's why, if you do get implant cases, they can tell that you're hardworking, you're diligent, and your hand skills are good. They'll let you do the implants, but it's not a guaranteed. If I do this residency, I'll get to do implants.
I see.
Yeah. Whereas like another, you'll hear of certain residencies where they do, all they do is implants. But the thing is, you also got to decide too, like if implants is something that you're not interested in, like, maybe that's not a strength for you for a program. Okay, where was I? FOSS, so we got to do, partials, complete dentures, single crowns, get more experience with that. So this next part is what I'm more excited about, is the perio and oral surgery experience that we get. We have a great periodontist on staff who's letting us do a bunch of cool perio surgery. I have a case coming up, which is a double pedicle connective tissue graft. I have an implant case coming up. We got to do flap osseous surgery, and we got to do crown lengthening. He's really good about letting, if he can tell that, all right, this guy's doing his reading, he's doing his homework, he really wants to do this, or she wants to do this, like, I'll let them do that and work with them with that. So for oral surgery, we got to do a lot of partial and fully impacted third molars, which is cool. Like, you have an oral surgeon right there. If you can't get it out, you know that they're right there to kind of guide you through. So it's good that we get that experience. And IV conscious sedation is a huge one that I'm really happy about this residency so far. Not a lot of programs. Well, let me say this. Some programs will give you experience in IV conscious sedation, but not a lot of residencies will actually credential you and give you certification for that. So that is one thing I'm very thankful for the Air Force, is being able to get my certification in IV conscious sedation. Endodontics, been doing a lot of molar endo, so more difficult cases, with calcified canals, maybe root canal retreats, or endo through a crown. So these are kind of just more difficult cases that you'll hear as you go along. And then biggest thing, early on in your career as a dentist is focus on treatment planning. I know I was here at one point too, like out of dental school, or as a fourth year student, I was like, man, like I really want to do implants, I really want to do third molar removals, I want to do all this like crazy surgery and stuff. Like I was so focused on that. But I think the more important thing is treatment planning, right? You have to really, in the beginning years as a dentist, really focus on treatment planning. And that means being able to look at a patient, kind of analyze their needs, and come up with an appropriate plan for them, right? So one dentist can look at one case and think, oh, he just needs a couple crowns here, and maybe we'll do a bridge on the lower. Where if you dive in deeper, you're going to find that the teeth are kind of, for the bridge, are kind of like this, and that would be really hard to put a bridge on. So probably can't do a bridge there. Had to look into other options like an implant or something else. And so the better you get at treatment planning, one, the more work you find yourself, right? Two, the better treatment you can provide for your patient, right? And then three, once you get that plan going, you're kind of not just like on the fly your seat, like, oh, what do I do next? What do I do now? And it's like you sit down, nope, this is the list of stuff, this is the plan. Once you get that solid, you can just kind of go down that list and kind of treat the patient back. So don't hyper focus on, right out of dental school, oh, let me get my molar CE, let me get my implant CE, let me get this and that. Just really, really take the time to, up your treatment planning game. So I included a case here to kind of show you the technology we have. Luckily, in the Air Force, we get all the shiny new toys that are not on our own dime. In private practice, say if I were to want to try to see if CAD/CAM would work well in my hands or be good for my patients, that decision is a $50,000 plus decision, right? I would have to spend the money to buy those machines in order to bring it to my office and try on my patients, and not even knowing if that's something that will benefit my patients or work well for me, right?
Right.
Luckily in the Air Force, they have all that in the residency program. They get to play with that. So here's a case where a patient came in. You can see on the left here with a gold crown. You can see his level oral hygiene here. Not great. So that's a number one step that I'm working on. So you can kind of see in these later pictures, they've kind of improved a little bit, very slowly. Anyway, we detected caries underneath this crown, decided to remove it. So this is what it kind of looked like after, right? We had caries. You could see a little bit of core buildup material that they used previously, some amalgam, right? Pretty broken down tooth. Okay. So what we decided to do was make a temporary crown for it. Okay, this is called this is something I learned in the Air Force, is a shell crown technique. So instead of building a core, so imagine you don't have this temporary crown here, okay, and you're just looking at this tooth right here. The goal, in order to get a temporary on there, you have to have more tooth structure, right? Or else the temporary can't hold on to anything. So if you don't do this technique, you'll have to kind of hand shape it and try to get a Topfenmeyer band around this in order to build up, a fat piece of amalgam, and then you have to painstakingly carve it down to be the right size, and then you have to prep it again for the crown in order to make the temporary crown fit. Well, what we did was make a provisional first off of a wax up that I did of the tooth, and cut a hole through the top, as you can see. And then through that hole, pack all the amalgam. So instead of having to, shape it and re-prep it and everything, all we did was make a temporary from a wax up that we did, and then fill it with amalgam. So it's perfectly adapted to the crown underneath. So then after that, after we stabilized the tooth, brought them back, refined the prep again in order to scan it with, this is called a CEREC scanner. You guys probably heard of CAD/CAM by now. It's been part of dentistry for a while, but it's really cool. I scan the tooth with the CEREC machine, and this is kind of what the program looks like. This picture on the right is grabbed from Google with these two. I couldn't take pictures of the ones in clinic and get them in on time. So this is kind of what the design process looks like. You kind of take your scan, you can kind of design your crowns. If you see all these little this heat map, It's kind of showing you where the contacts are in relation to the opposing arch. Oops, let's go back. So you see like this red spot here, that just means it's touching the other tooth a lot.
Right.
So anyway, you just kind of design the tooth however you want it, make it perfect for the case at hand. And the next step was really cool. So the patient wanted a, since he started with a gold crown, he wanted to end up with a gold crown. So usually with a gold crown, you have to do a traditional wax up, right? Like you see on the left, which first year of dental school, you guys you'll find out it's very painstaking process.
Great.
And obviously through time you get better, but it still takes a lot of time, a considerable amount of time, right? Even for really experienced dentists that are, this is a great wax up, but that probably still took, even an experienced person 30 minutes to an hour, right? So instead we had the scan from the CAD/CAM machine. I designed the crown in CAD/CAM and then actually milled out my wax up. So this material that you see here is a wax-based material that this machine, which is called the InLab MCX5, it's a 3D milling machine that kind of takes this like hockey puck of material. This material can be wax, it can be acrylic to make temporaries, or it could even be material that you use for a final crown. So it can really mill anything. And so in this case, we milled a wax up instead of me spending time to do this. Unfortunately, I'm still waiting on the the lab to give me to cast the crown in gold. But what you end up with is the same final product. It's just you kind of get to skip some steps with the traditional wax.
Right.
So and these are just kind of like the cool toys that we get to play with in residency. And then I have a second case here. Just really quick. How are we doing on time?
We're doing great. We're doing great.
Here, let me see. So I just did implant boards to work up a patient for an implant. So this is kind of just showing more technology that we get to play with here. So this patient needed an implant in site number 19. Let's see. Okay, so you can see this site here is where we're thinking of placing the implant. This is some things about his medical history I had to talk about through him. So you can see here, this is the empty site, the edentulous site. Here's some mumbo jumbo. You guys will learn all this in dental school. Don't worry about this yet. So what I did was made really good casts for the patient and kind of looked at how much space do I have. So there's I guess the point of this showing this case is to kind of show, even though we have all this cool digital technology nowadays, the analog is really still what at the end of the day, like what makes sense and what you have to learn first in order to use all this digital dentistry, right?
Right.
You have to start somewhere. The analog is even if you can do fully digital implant cases nowadays, it's still really, really important to kind of understand the analog way of doing it. So got the analog cast and took a look at how much space that we needed. Made a radiographic guide. So this is if you can think of as a preliminary surgical guide for our implant, okay, for our proposed implant position. So what we do is we make it as good as we can angulation-wise, and we go and we take a scan, a 3D scan. So this is just a 2D, but I'll show you a 3D scan here. To take a 3D scan of the guide in to see that if the positioning is correct. And again, don't worry about all the numbers. You'll learn all these in dental school. But in this
this was a guided implant.
Yeah, this will be a guided implant. Yeah. So this will be a guided implant and determine that through the scan everything looks good. Where we're proposing the implant to be, it'll work out. So yeah, that's just another cool thing that we have
Awesome.
At our disposal. Okay, go back here. Okay. All right, so this is just couple advice to future dentists and also me as well. I have to constantly remind myself as well. So this is actually a quote from one of my training instructors at Oxford Training School. Whether you think you can or you can't, you're probably right. And so he told us this on an obstacle course. On one of the days we get to go out on this big obstacle course. I don't know if you guys are afraid of heights or not. I'm a little afraid of heights. And one of the obstacle courses is you have to go along this 2x4 beam that's probably like 30 steps across, and there's 3 of them, right? The first one is just on the ground, right? Easy peasy. The next one is about one person's, one body length up, and the last one is about 2 body lengths up in the sky. So for me, like, I looked at the top one, I was like, man, I don't know about that. And so he told us this quote. He said, whether you think you can or you can't, you're probably right. So what that means is, if you're sitting there and you're thinking, man, like, I don't know about this, like, can I do it? Like, I probably can, like, and there's no way I can do that. Then you're probably right. You probably can't do that, because if you don't believe in yourself and you don't believe, oh, I can tackle that, then you're not going to be able to do it, even if you try. So it's all about the mindset going in. I looked at it and I kind of said, all right, I'm gonna try it. If I fall off, I fall off. That's cool. I have friends that are going to catch me, but I feel like I can do it, right? So it's all about the mindset that you tackle issues with. The next thing is never get comfortable. Okay. Once you think you know everything, that's kind of the point where you're gonna fail, right? You think you know everything, you don't know everything. There's always more to learn. There's always something that you can learn from other people. So be humble and keep learning. Another thing is, even in dental school, keep shadowing, keep increasing your exposure. There's things that you've seen in the past, in your past experiences, like shadowing, that once you learn more about dentistry, and you go back and shadow, you can get so much more from that experience than you did before, because now you understand more of the game. So you can talk to the dentist on more of a professional level. You can talk to him more and learn even more about dentistry. And last one, most importantly, is keep asking yourself what your vision is, right? I kind of do this, it's hard to do this, especially if you get really busy on the grind, you kind of forget about it. You're more worried about, I got to do all this orgo test, I got to do all my DAT, but kind of take the time, once in a while. I do it at least bi-weekly, kind of just sit down and think, okay, are my goals still the same as they were before when I wrote them down? If they've changed, then I can kind of say, or if things have changed, I can be like, okay, this is what I want to do. This is what I will do to get to that point. And kind of just keep, reflecting on that, so that you don't, lose sight of what you want in the end.
Awesome. Empowering words. Yeah. Thank you so much for sharing with us, such a unique insight into your experience as an Air Force dentist. I think it's a very valuable insight for a lot of us who are, interested in pursuing a dentistry. So we thank you.
Of course, my pleasure.
So at this point, we'll turn it over to our chat moderator, Alexis, so we can address a few questions from the chat before we conclude today's presentation. Alexis, please feel free to take it over.
All right, so first question, what made you choose the Air Force rather than any other branch?
With the Air Force at the time, they were the only ones that offered a 2-year program, a 2-year scholarship. So there's a 2-year, 3-year, 4-year program. And at the time, they offered a 3-year. Long story short, I applied for it. The recruiter wasn't great. He lost my application. So I had to reapply and I got the 2-year, which I'm still very thankful for. But I chose the Air Force over the Navy and Army, I guess. I'm not really sure. I mean, most of my mentors at the time, they were also from the Air Force. So that's kind of why I focused in for the Air Force. But they're okay, all great, branches and all great programs that you can apply for if that's something you're interested in.
Is the payback the same for all branches?
So yeah, typically how the HPSP works, or the Health Profession Scholarship Program works, is it's a year-for-year thing. So typically, like if you get a 4-year program, right? So they'll pay for 4 years of your dental school, and in school you'll have a monthly stipend, about like anywhere from $1,500 to $2,000 depending on where you live, and that's to pay for your rent and your food, and then obviously whatever else that you have left over for. And then afterwards you owe them 4 years of service. So without getting into the weeds of it, mine was a 2-year, which is also year for year. I still owe 2 years, but for military contracts, usually the minimum is 3. So you have to payback 3 years, no matter how long of a contract you sign up, right? So then how do I only owe 2 years at if the minimum is 3? The 2-year program, at least now, the way it works for the Air Force is if you get a 2-year scholarship, your AGD year, because the AGD residency is required now for the Air Force, your year in the AGD counts. So that'll be my first year, and then I owe 2 more years after that. Whereas if you did a 3-year program for the Air Force, the AGD year doesn't count. So you would do the AGD year, and then you have 3 more years of service that you owe. So total 4 years of service in the Air Force. So that's just a stipulation of the 2-year program currently. And things always change with the military. That's the thing.
Right.
And yeah, that's why the main reason I made my or starting posting for social media, started my page, was kind of help provide a more current resource for people that are interested in that. Because when I applied, like, there's a great blog, but it was from like 2010, and a lot of the things have changed since then. But it still really helped me with the application process. Hold on, Alexa, I didn't hear. I don't think I heard.
Yeah, Alexis, sorry, do you mind, just to the viewers, we apologize. I think there were points in the presentation where the audio was cut out. Alexis, do you mind repeating that, please?
Yeah, can you hear me now?
Yeah, perfect.
Okay, good. So if you do the AGD residency, can you still go into specialization? And if you just want to go from dental school straight to specialization, do you have to do the AGD residency?
So for the Air Force, yes, you do have to. You have to do the AGD residency if you go into the Air Force. But in general, no, you don't have to. If you know that you want to be an oral surgeon, or if you know you want to be an endodontist, like, you can go straight from school and specialize in that. There are cases, if you're not sure, or if at the time you're just like, oh, I want to do the AGD residency, because you don't know if you love something, just to do that one thing. Then an AGD program can also help you decide that, because you get to dabble and dip your fingers into all the different specialties to see if you like them, right? Like in dental school, your periodontics experience is scaling and root planing, which is something usually that hygienists do. Sometimes you'll jump in if you're not as busy, and you'll help do scaling and root planings, or if you need to do that for your patient. But that's typically the only periodontic experience you have. Versus in a residency program, you get to do some periodontal surgery, like crown lengthening, flap osseous, and stuff like that. So, you might do their AGD residency, like, man, like, I love doing perio surgery, and then end up deciding to specialize in perio. So, not required to do a residency, but it can certainly help you decide. There's nothing wrong in not knowing right away, oh, I want to be an oral surgeon, or I want to be a periodontist, like, right away, and kind of helping you decide.
Is there anything you dislike or wish you knew about serving as an Air Force dentist?
Well, since I'm in the residency program now, I haven't really filled the shoes as like a normal, like a primary care provider, because we're in a learning environment now. So it still kind of feels like dental school a little bit, in the sense that we're not seeing the same amount of volume that we would, and we're not alone, right? We have great staff that are kind of teaching us all these complicated procedures that we haven't done before. But next year, once I go off on my own, like, these are the things that I'm going to be faced with and kind of have to deal with myself. Nothing. I mean, I'm really grateful for all the things that have been provided to me for the Air Force so far. There's really no complaints. The main benefit of it is being not having the pressure of production, right? In the Air Force, I get paid the same amount of money whether I do, see 10 patients versus 30 patients in a day, right? And that's not to say I don't want to see 30, see as many patients as I can. It's just there's no added monetary pressure from that. So especially in the first beginning years of my practice of dentistry, I can really focus on the clinical aspect, patient care and caring for patient aspect of that, and really hone in on those skills in my treatment planning skills before, one day it'd be nice to own private practice. I'm not sure, just depending on how long I'll stay in. But one day I would like that is my goal, is to open up a private practice and And at that point, you know, then I'll add on the stresses of owning a business and all the other stuff. But that's not to say that you can't go out and straighten up and do that, right? I have really good friends that have gone out and opened up their own practices, and they're killing it. Like there's different strokes for different folks, and kind of you just have to answer that question for yourself. And actually, let me plug in a great podcast here to listen to. Well, two great podcasts. First of them is run by some of my good friends in dental school. It's called the Dental Student Podcast. Great podcast to listen to if you're a dental student. And the second one is kind of more geared towards answering the question of, is private practice right for you? Is ownership right for you? And kind of helping you decide what career path to take in dentistry. And that podcast is called Shared Practices, and it's run by a guy named Dr. George Hariri. He's an Army trained dentist, and during his time in the Army, he kind of was asking himself that question. He was like, is private practice right for me? And at the time, there wasn't really a good systematic way of kind of how to own private practice. And so he kind of goes season by season, first season being, is ownership right for me? And then kind of goes deeper and deeper into it as the seasons progress. But give a listen to the first season. It is great. It'll really help you, you know, think about things. And he talks about what it is like to own a private practice, you know. And so that really helped, you know, guide my decisions too, and writing down my goals. So great podcast.
Thank you for that. What were some of the things that you think helped you as an HPSP applicant?
Like as far as my application, like to get the scholarship?
Right.
Okay. I think well-roundedness in general. I really liked volunteering. I stayed involved with, you know, we had local like underserved clinics that we go to about once a month, and we were able to provide free care for the community. Another thing I really liked was mission trips. We have a guy, great, bless this man, Dr. Garvey. He's been running this mission trip for over 33 years. And I went there my second year dental school, and like loved it. Like there was no better feeling than like going there and like, you know, and providing care for the, like some of these people haven't even heard about a toothbrush or a toothpaste. Like, it's crazy. And it's really sad sometimes. But it's stuff like that that I really enjoyed doing. And I think that helped a lot in the process of applying.
Once you're done with residency, will you have a choice in where you are stationed?
Yeah, so we get, if you're an officer in the Air Force, you which you will be if you join through the scholarship program, you get what's called a dream list. And so that dream list, you get to rank your top 10 places that you want to go. And from those top 10, they kind of try to put you, you know, within that top 10. And it's not a simple process because, you know, you have to think from their eyes, right? You have to think, oh, we have X amount of dentists in the Air Force, and there's this many bases. And obviously, people are moving around every 2 or 3 years. So it's really hard to coordinate who is moving where, you know, at what years. So they have to worry about that. That's one factor. And then the second factor is they want to, like, it depends on what you're credentialed into, right? So part of the residency program in the Air Force, you get credentials for certain things based on your staff's interactions with you. So if you're really gung-ho about it, you can get credentialed in a lot of things. And that kind of makes you like, okay, like I want this guy, I feel more comfortable with this guy or gal going to a more remote base and providing care because he's credentialed, you know, and his staff have told me he's credentialed these things and he's proficient at these things. And he or she can do those things comfortably. And so that kind of plays a role into it too.
Is there a way to become a military dentist if you don't get the HPSP scholarship?
There's multiple pathways. I'm not too sure about all the specifics of all of them, but I know there's a loan repayment program that you can do with the military. So you can do that. You can also come in as a civilian dentist or a civilian specialist. Like one of our oral surgeons, she trained at a civilian program and signed a contract with the Air Force to be an oral surgeon for them. And all that is kind of based on the need, right? So at the time when the oral surgeon joined, there was a need for oral surgeons. So she was able to join the Air Force from a civilian program. So it all depends on the year and the needs of the Air Force, or the needs of the Navy or the Army.
Someone from the chat is asking, how do you deal with burnout?
With burnout,
Mhm.
I feel like burnout is one of those things. I mean, it's just like exercising, right? You can't let that, build up and just get to a point and just like bottle up, and then by that point you're just gonna explode and it's not gonna be good. And I've definitely been there, right? And kind of a big thing I learned first year of dental school was kind of how to manage that stress. Week by week, instead of like letting it build up, and then finals comes and you're like freaking out and you're like, oh my God, and then you deal with it, right? So a lot of it is just telling myself like, hey, go take the 2 hours and you need to go work out, do it at least twice a week. If your friend wants to go get lunch, you might think, I don't have time, like just take an hour, go have lunch with your friend, because you're going to be happy to see your friend's going to be happy to see you. You get a little break, and then when you come back to your work, you're not going to be so like mentally foggy or mentally burnt out, and you'll be able to be more productive in that time, even though you have less time to work. So you'll be more effective with your time if you kind of allow yourself to recharge and relax.
How competitive is it to specialize when you're part of the Air Force?
I would say it's pretty similar to civilian programs. Like orthodontics is always going to be the number one, the most competitive thing, because that's what everyone, it's a very popular one to do. Oral surgery, it's a very tough residency. So generally, I mean, it's very tough to get in because their bar for you is very high. But then in general, the applicant pool is smaller because not as many people want to be oral surgeons as they do, orthodontists, just by the nature of it. But it's still competitive. I would say it's about the same as any other civilian programs.
A few people in the chat asked, what's the timeline for the application process for HPSP?
So you want to start as early as possible. So say I was applying for next year's cycle. I would want to reach out to a recruiter and get connected. There's a saying in any military branch is hurry up and wait. So start everything early. You're gonna reach out to the recruiter, they're gonna get back to you, be all excited about getting you signed and send you some paperwork, and then you can do all that paperwork and then send it back to them. Then you're gonna wait like 1 or 2 months until something happens. So I would start in January, reach out to a recruiter, and really like get on their butt about things. Like I was texting my guy like after the new recruiter took over. He was really great, but before I was like really hounding the guy like every month, every 2 weeks, like, hey, what's the status? Hey, what's the status? And that's the only way that you're gonna get your stuff through. So start the process early in January to kind of get your application together. It's very similar to applying to dental school, in that you'll need your CV or your resume. You'll need you need to prepare like for your interviews just the same way. So nothing's very different about that. The main difference between the like a normal interview for dental school and an interview for a military program is why you chose the military. And so you just have to really be able to answer that question for the interview. But other than that, everything is pretty similar. And so that let's see, January, start applying, give yourself at least 6 months, right? To get all your stuff in. If you are accepted into like the initial preliminary phase, you'll get invited to go to MEPS, which is medical processing. And so you'll have to go, they'll put you up in a hotel somewhere, usually with, like when I went, it was with a lot of basic training people. So it was with 18, 19-year-olds who are just joining the military through the normal pathway, the normal pipeline. Put you up in a hotel somewhere, and the next morning you go and you ride to the base, and they do a physical checkup on you, like full drug testing, all that to make sure that you're fit for service. And the one thing with the Air Force is that they're very strict about the health screening process. So this is something that you should work with your recruiter, and help getting your application straight. After that, if you're all cleared, then you kind of wait again until I think the board meets. They'll have interviews from August to October timeframe. So we just had a couple applicants come through our base and check out the clinic and stuff. But August or October is kind of when that happens. And then the board, kind of like a rolling basis, they'll meet and then they'll make their final decisions about November, and you should hear in December if you got it or not.
Awesome. Awesome. Well, unfortunately, that's all the time we have. Again, I just want to apologize to the viewers for the audio cutout. Unfortunately, that's just the reality that we have to deal with in this the new virtual landscape. But nonetheless, thank you so much, Dr. Lan, for providing us with such a unique professional insight into your path and into your journey, into your career as a dentist in the Air Force. And I'd just like to reiterate, the chat or the quiz for today's session will be posted in the chat and can be also found in our Instagram bio. And with that being said, we want to wish everyone a productive year and a good night. Thank you so much again, Dr. Lan.
Yeah, of course. Thanks for having me. And if you have any questions, feel free to reach out to me. I'll put my email here and my Instagram here. So reach out to me on either or, and I'd be happy to answer your questions.
Awesome. Thank you so much.
All righty.